afternoon, and thank you very much for inviting me to give a speech at this conference. My speech is based on an original article that first appeared in the Journal of Clinical Nursing in 2014, and it is also part of my PhD thesis. And I'd like to acknowledge my supervisors and co-authors, the Professors Bjørg Karlsen and Edmund Bru from the University of Stavanger, and Professor Helen Allen from Middlesex University, UK, and also Professor Jon Arne Søreide from Stavanger University Hospital. The background for our study was that regular physical activity during breast cancer treatment might have several positive outcomes, including less of a decline in overall quality of life. But women with breast cancer may experience a decrease in physical activity following the cancer diagnosis. And we found in our randomized controlled trial that adhering to an exercise intervention while being treated with chemotherapy can be a challenge. And also, chemotherapy is found to be one of the most important factors for decreased physical activity during breast cancer treatment. And treatment-related barriers to physical activity might account for more than 50% of reduced exercise participation in breast cancer patients undergoing chemotherapy. However, there is a growing interest in breast cancer patients' motivation to participate in physical activity, and the perceptions of the women on how exercise may stimulate or discourage exercise during treatment is yet not fully investigated. So the aim of this study was to explore the factors that might influence exercise adherence among a sample of early-stage breast cancer patients who had participated in a randomized controlled trial testing a home-based exercise program during chemotherapy. And as you can see here, we used a qualitative design with 5 focus group interviews and explored the patients' perceptions. A total of 27 women participated in the focus groups based on their participation in the exercise intervention group. And we also systemized and analyzed the data by the in vivo 10 and systematic text condensation. And this is the characteristics of the participants. The mean age of the sample was 52 years, and the majority lived with a partner. 43% had children living at home, and 46% had a university degree. And nearly half of them were currently employed. 64% had had a lumpectomy, and 46% received an adjuvant chemotherapy treatment containing the taxane monotherapy. And nearly 90% reported to be physical active at a moderate physical activity level for more than 6 months pre-intervention, and they exercised for a mean of 19 weeks and sustained a moderate activity level during treatment. And these are the 5 main themes that we found from the analytic process. One about side effects from the breast cancer treatment as a barrier to exercise, and also other valued activities competed with the exercise. But restoring and maintaining normality in daily life was a motivation to exercise, and also constructive support and positive beliefs about efficacy and outcome expectancies motivated to exercise. The women experienced treatment side effects and struggled with them, and they described them as a big barrier to their exercise activities, like in this quote from one of the women here. The tiredness, lying on the couch feeling like I was in a coma. I should have been out walking, but I just stayed on the couch. And the side effects from the exercise made them exercise less, but sometimes they also acted as motivation to exercise, especially since going for walks in fresh air reduced nausea and increased energy level. A changed body image due to treatment, and also how their bodies responded to exercise affected the exercise efforts. And a mastectomy required the use of a prosthesis, which had to be well adapted, or else the women feared it would fall out during exercise. For most of the women, the chemotherapy also resulted in hair loss, and they told that wearing a wig during exercise was not practical, and it also felt uncomfortable as soon as the exercise made them start sweating. As in this quote, "I stopped going to the gym when I got cancer. I was afraid it would show in the neckline, and my head got really heated from wearing the wig during exercise." And in addition to a changed appearance, the women also experienced changes in how their bodies responded to physical activity, which they attributed to the chemotherapy. And as a result, they experienced both dyspnea and dizziness and created feelings of distrust in their bodies. Like this woman here says, "I have to say that I used to trust my body. When I went walking in the mountains, I knew how much it could take. Well, I don't trust it anymore." The women also experienced and reported the same obstacles to exercise as is found in a general healthy population. And one of them was limited time to exercise, like this quote here. "After receiving the last treatment, I felt like hitting rock bottom, and it was Christmas, so I decided on preparing for the holidays instead of doing my strength exercises." And now moving on to what motivated the women to participate in exercise during treatment. The women discussed different types of support they received and how it acted as an important motivation to keep on exercising. The support came not just from family and friends, but also from colleagues and health professionals. Like in this quote, "Guidance, support, and advice from the nurse was really helpful, and I needed to be pushed a little." And the quotes or the support they received that made them feel good about themselves, and they felt that they were cheered on. And furthermore, the women talked about how exercise helped them to restore and maintain normality in daily life. The fact that they could exercise during treatment spurred them to activity, but it also helped their families to relax more, which again motivated the women to keep on exercising. It was one of the most positive things in my life at the time, and one of the really important activities I had planned for each day. I put the iPod on, put on my boots, and walked. I was not just a person with cancer, but someone who exercised. And in the following quote, exercise motivation was expressed as beliefs and outcome expectation towards exercise. "I thought that if I didn't do it, my body would quickly deteriorate, because when I saw what the poison did to my body, if I hadn't done something for myself, it would have been even worse." And doing something good for myself was an expression shared by many of the women, reflecting thoughts on ability and coping mechanisms. "I felt I had done something big when I went for walks feeling lousy. Even though it was just around the corner, I felt I had done something good for myself, even after walking for just 10 or 15 minutes. So, to conclude, the treatment side effects act as an imperative barrier to influence exercise adherence in breast cancer patients during chemotherapy treatment, and a need for balancing between investment in exercise and other valued activities might negatively affect exercise adherence. And to maintain a normal daily life, exercise participation seems to propose some distractions from worries about the disease, acting as motivation to exercise. And social support is crucial to breast cancer patients' health behavior change. And when communicating exercise as health promotion, health professionals should support the patient's belief that they are capable of changing their health behavior and provide support on how to do so. Exercise programs should be individually adjusted for experienced detrimental effects of the employed chemotherapy and for the function exercise has for the patient. Thank you for your attention.